Hello. Today I'm going to tell you about the Momentum Project, working with first-time parents to increase uptake of gender and health behaviors in the Democratic Republic of the Congo. The Momentum Project was a research study in Kinshasa, DRC, led by Tulane University and supported by the Johns Hopkins Center for Communication Programs, or CCP, from 2018 to 2020. The objectives of the project were to increase uptake of postpartum family planning among first-time mothers aged 15 to 24 years, improved care seeking in maternal and neonatal health household practices among first-time mothers, and increased gender equitable behaviors related to FP, MNH, and nutrition among first-time mothers and their male partners. There were three main project components. The first two were led by Tulane University and the third by CCP. The first was household visits to first-time mothers and their partners conducted by trained nursing and medical students using a mobile counseling app. There were also group sessions with first-time mothers and their partners held separately using guides based on Permundo's H&M empowerment programs. And the third activity was community-based activities with key influencers of first-time mothers to create an enabling environment for behavior adoption. And this is the activity that I will focus on today. CCP used a human-centered design approach to develop the various activities that were held with the community members and key influencers. There were 5 steps: empathize, define, ideate, prototype, and test. First, we empathized and tried to understand the context. In Kinshasa, by the age of 18, 22% of women are married and 14% have had their first child. And modern contraceptive prevalence, while it has increased in the last few years, is still relatively low among 15 to 24-year-olds, with 40% of sexually active unmarried women and 33% of married women using a modern contraceptive. We next wanted to better understand the audience, and we did this through a series of focus group discussions with first-time mothers, male partners, and mothers-in-law of first-time parents. We found that mothers and mothers-in-law frequently described the negative ways in which the community might talk about a first-time mother and how that could impact maternal and neonatal health care seeking. And FTM's pregnancy influenced how people in the community might talk about FTM's family as well. Commonly used words or phrases that described the community attitude towards young FTMs were particularly negative. These included denigrated, made fun of, that they were prostitutes and had no value, they weren't taken seriously, and they weren't educated. During these focus group discussions, we also found that unmarried FTMs face less pressure to consult their parents or partners about using contraception compared to married FTMs. Married FTMs are expected to follow their husband's decision about FP use, and FTMs are not expected to use postpartum family planning, and those who do often face social stigma. We also found that parents, particularly mothers and mothers-in-law, but also fathers, played important roles in preparing their children for the future. Mothers and mothers-in-law saw themselves as key sources of information for first-time mothers, also as companions and decision-makers who were responsible for care seeking during a first-time mother's pregnancy, and sometimes even for taking care of the newborn. They also saw themselves as communication partners and sources of support. Momentum focus group discussions also found that mothers-in-law found the influence of one's mother or mother-in-law was influenced by multiple factors. These include who the FTM lives with, the age of the partner, the quality of the couple's relationship, if the FTM or her partner had money, etc. Based on all of this data, we created a definition statement, a how might we statement, and we focused this statement on family planning in order to better tailor the approaches and solutions that we could come up with. So we looked at how might we create an enabling environment to increase uptake of postpartum family planning services among first-time parents using their influencers, so parents, in-laws, partners, etc. We held 2 hackathon-style 2-day ideation and prototyping workshops. These workshops examined barriers and facilitators to sexual and reproductive health service use among first-time mothers, rumors, sources of health information for young women, and their key influencers. In the workshops, we had rapid idea generation followed by pitches on the top 3 ideas or prototypes. The first workshop included first-time mothers 15 to 19 and 20 to 24, mothers of first-time mothers, and mothers-in-law of first-time mothers. The second workshop included first-time fathers, friends of FTMs, and male friends of first-time fathers. Some key insights from these workshops included the benefits of family planning, barriers, shame and embarrassment, lack of information, cost and fear of side effects, sources of information, internet, school, friends, church, health center, mother and grandmother, and who youth trust to talk about sexual and reproductive health, friends, older sisters, and their male partner. These insights were used to develop 13 total prototypes. I won't go into these in detail now, but you're free to reach out to us at the end if you're interested in any of these in particular. We followed the prototyping stage with the testing stage. So we rapidly tested all 13 prototypes in the communities in Kinshasa. The first round tested 9, and the second round tested 4. Out of these, we found that the most popular prototypes addressed concerns and questions that were centered on rumors about methods and their side effects, and they challenged cultural norms, encouraged intergenerational discussion on taboo topics in a safe environment, and provided testimonies from real people. Based on these results, we came up with 4 final prototypes, and these were adapted to focus on the multiple health behaviors and gender topics of the project. We held at least 36 sessions per month in 3 different health zones in Kinshasa on newborn and infant care, nutrition, which included exclusive breastfeeding, women's diet during pregnancy and after delivery, and complementary feeding, the roles of accompaniment and support for young pregnant women by their families and friends, gender and gender-based violence, adoption of FP methods, including postpartum adoption and kangaroo mother care. And the participants in these sessions were varied. We had mothers and mothers-in-law of FTMs and male partners, fathers of FTMs, male partners of FTMs, and also friends, both male and female, of FTMs and their male partners. The first prototype that we kept were testimonials. These addressed misconceptions and myths on health behaviors through film testimonials from influencers, parents, partners, and in-laws. And these were followed by a guided discussion with the health provider. Second prototype was true or false. This was a question and answer session on health and gender issues to dispel myths and rumors in an interactive environment, and this was also led by a health professional in order to dispel any misinformation that came up during the session. The third prototype was Theater Bala Bala, which was a drama program and comedic theater to educate the population on health and gender issues, and each sketch was followed by a facilitated discussion with a health provider. The final prototype was called Moziki, and it was based on a positive diva approach of testimonials, where peers testified about their experience with a particular behavior and exchanged with their peers about why they should do it. Between October and December 2019, CCP conducted 16 focus group discussions with 192 male and female participants between the ages of 18 and 49, following these community activities. The objectives were to understand the community views on Momentum's activities, explore participant views of the activities and their behavioral intentions, and gather recommendations from the participants to refine the activities. The questions focused on the participants' participation in the activities, knowledge of the purpose of each activity, understanding the messages shared and their importance, the intention to share this knowledge with other members of the community, and their change of opinion and intention to act. Over 21,500 men and women participated in 358 sessions of these community activities between March and December of 2019. During the focus group discussions to monitor these activities, the vast majority of participants expressed that participating in these activities not only changed their opinions on these subjects, but also their intention to change or adopt a new behavior. I have a couple of quotes I'm going to read from these discussions. Before, there was a woman who talked to me about family planning, but I didn't believe her and I didn't understand. But today, I myself have just attended the theater scene where they were talking about adopting the contraceptive methods. Today, I am informed. I believe now I want to choose a method and use it without fear. Also from a woman in Matete. And then the advice I have just received here, I want to pass it on to my little sister who is pregnant and doesn't know all this. She prefers to eat turkey instead of vegetables. That was from a nutrition video testimony session in Kinshasa. We have a few lessons learned. This may be obvious, but I want to reiterate it here. Formative research was essential. It guided the content and participants who was chosen to participate in the sessions. So not only the focus group discussions, but also the ideation workshops. Through this research, we found that parents and fathers, especially, which was a surprise, emerged as a key influencer group for their daughters around health topics. Generally, people think of it as being mothers and mothers-in-law, but fathers also play a key role. And kangaroo mother care, which was an important health behavior for the project, was virtually unknown, so we added sessions around that topic specifically, and people were very interested to learn about it. Holding regular feedback sessions with participants to ensure that the content and structure best fits their needs is really important. For various reasons, we didn't do this as much as we would have liked throughout the project, but when we did do it, we found some really important takeaway messages from the participants. These included the request for take-home educational materials, which could have boosted the spread and retention of messages once they returned home and wanted to share with their friends and family. Participants requested more hands-on activities as part of the sessions, like cooking demonstrations during the nutrition sessions, or having physical examples of contraceptive methods available during the family planning sessions. And it would be really important, I think, to include other influential people in the community, such as community leaders, religious leaders, and traditional authorities, to better address the social norms and policies at play that are related to the different themes. So thank you. If you have more questions or want more information about this Momentum project, and in particular the key influencer activities that we organized, you're welcome to contact me, Hannah Mills, or Zoe Hendrickson for more information. Thank you.